illness after Justin Timberlake released his Lyme disease diagnosis. So joining us now is Dr. Chris Shade, founder and CEO of Quicksilver Scientific, to talk about the illness and the road to recovery. Good afternoon to you, Doctor. Thank you for joining us.
Good afternoon. Thank you for having me.
All right, so Doctor, start by telling us what exactly is Lyme disease?
Yeah, well, Lyme disease classically is an infection with a bacteria called Borrelia burgdorferi. It's a spiraling bacteria that can work its way into your body, into your joints. It can cause a whole bunch of different symptoms. There's joint pain, there's severe fatigue as it breaks down mitochondria. It can get into the brain and cause what's called neuroinflammation, can have a lot of neuropsychiatric effects. And it's very debilitating on the body. It has so many different symptoms that it can look like a lot of different things. But when you get bit by a tick, there's not just Borrelia, there's what's called the 3 Bs. You can also get Babesia and Bartonella. All of these have slightly different symptoms. You may have all three of them at once, or you may have one, and there's multiple different species of each. So it can be very difficult to test for. And even 20 years ago, you could lose your license if you treated this. It's only recently that we really know that this is an actual thing that we can pin down and we can treat. But it's very difficult to treat, and it's crippling on the body sometimes.
If I could step back to something you said a moment ago, we talk about how it cripples the body, but you're also saying this also has a mental component to it as well.
A very big one. When it gets into the brain, that's called neurolyme, and it'll cause something called neuroinflammation. And at its lowest level, that's going to create a lot of anxiety. And as that runs a lot, you get anxiety and depression. But it so dysregulates the neurotransmitters in the brain that you can have very strong neuropsychiatric events from it. People are going to have semi-psychotic events. And so a lot of the doctors will look at that and put people on neuropsychiatric medication when they need their Lyme disease treated.
Doctor, we might have heard Lyme disease in the past. People get it when they're out hiking, and to be careful about it. Is that the most common form of transmission? And who really is most susceptible to perhaps getting this disease?
Yeah, people who are in the outdoors a lot, especially in the Northeast, and you get over into Wisconsin and Illinois, you have massive prevalence of that. I have friends who are doctors in the Northeast, that every single person that comes in gets tested. The prevalence is very, very high. And it used to be just in the Northeast. This was first found in Lyme, Connecticut, because it was thought to originate in a biologic facility off of Lyme. And it's spread from there, and it's across the whole country now, but the most in the Northeast. So if you're up in New York and you're hiking outside, you want to wear long clothing, you want to wear a hat. When you come home, you want to check yourself for ticks and get rid of those. If you get a tick bite, there's what's called a bullseye rash. It'll be a big round rash around the infected area, but less than 50% of the people that get Lyme disease get the bullseye rashes. So you have to be very aware of when you get tick bites. And if you have any symptoms that are like feverish, or you get that rash, you need to go to a doctor and have it addressed.
Doctor, Lyme disease apparently has an effect on your immune system too when it fights back. So first of all, how long does this disease affect the human body, and what is its impact on the immune system?
Well, it's very rough on the immune system because it's immunosuppressive. It will turn down the immune system. There's something called natural killer cells, CD57s, which you can monitor, and these things called CD4s. And when those are down, your ability to resist infection goes really, really far down. And so you tend to get a lot of other infections that come with it, especially a lot of viral. So people will get a lot of Epstein-Barr and cytomegalovirus. This will increase the fatigue. And that effects of depressing the immune system can last for a long, long time. In fact, people can kind of cycle in and out of Lyme. We're starting to believe that Lyme will sit in your body kind of like a herpes virus and wait for a time that it can reactivate again. So it's really important to get it and adequately treat it and get your immune system up and running, and watch it over time and make sure that you don't dip back down.
Doctor, we only have a few seconds left here, but what are the treatments for this?
Well, there are traditional antibiotics, but long-term antibiotics have been shown to not really do a very good job. So usually people use a blend of antibiotics and some natural herbal compounds. The most common is called Cryptolepis, and that's an African bark, and that's been the best one of late. There's also Japanese knotweed and artemisinin. These are very, very helpful in knocking it out of the body completely.
Dr. Chris Shade with Quicksilver Scientific, thank you so much for joining us and providing your insight, especially when many people are going to be heading outdoors with the improving weather across the country and here in the Bay Area as well. We appreciate your time.
Thank you.
Well, doctors are raising awareness about a little known but serious disease carried by a tiny bug that's spreading here in California. It's called Chagas